Welcome back. According to a 2015 Centers for Disease Control study, just 40% of girls and 21% of boys in the U.S. have received the HPV vaccine. Factors hindering uptake include anti-vaccine campaigns, safety concerns, a sex stigma, and a lot of pediatricians may be reluctant to discuss the issue. Joining us this morning is Dr. Russell with the Baton Rouge General Pennington Cancer Center. How are you this morning?
I'm well,
thank you so much for getting up so early.
Oh, yes.
Well, let's talk about why these numbers are so alarming.
Well, the human papillomavirus is associated with some known cancers, particularly cervical cancer in women. And the incidence of HPV, or human papillomavirus infection, is about 80 million people in the United States, with 14 million new cases per year. The use of the vaccine has been shown to decrease the risk of infection, provided it's given at a young age.
So they're asking not just girls, but also our young boys to get vaccinated as well, but maybe many parents are not so sure about doing this?
Well, this vaccine has a lot of issues attached to it, like you mentioned in your intro. It is preventing a virus that is almost exclusively sexually transmitted. Okay. So you get into all the issues of...
if my child is not doing that, there's
right.
no risk. Okay. Right.
But the recommendations are that young boys and girls be vaccinated at age 11 to 12. There's 3 injections, one at one and then one 2 months later, and then one 6 months later. And young men up to 19 and young women up to 26 years of age if they haven't been vaccinated.
What are some of the risks, if you know, that can happen?
Well, if you really look at the data, there's a lot of stigma about vaccines in general, and there are a lot of concerns that some are supported and some are not. The real risk of the vaccine is a local injection site reaction, which is not uncommon, but it's not anything that's not manageable. There also is an interesting phenomenon of fainting in young girls. It may not be right at the injection, but somewhat thereafter. And pretty much that's it. If you look at the other side effects that are carefully studied with placebos, they're about the same. So those are really the risk. There's a lot of concern on the internet and a lot of groups talking about a lot of different issues, but this is not a live vaccine. This is actually a vaccine made from the envelope that the virus resides in. This is a virus that has to be transmitted to a mucous membrane or a skin membrane with some form of trauma, and it sits in the membrane for a long time. A lot of people clear it within 6 months without a vaccine, but some don't, particularly those who are immunocompromised. And in South Africa, where HIV is prevalent and HPV, the incidence of cervical cancer is very high. And cervical cancer is a difficult disease. And in both young men and women, I'm seeing more oral cavity cancers, which is very difficult to treat. Tonsils, tongue, cancers that occur in the part of the body's immune system that rings the back of the throat.
Okay, so are you saying with all of this that, and you have 6 children yourself, that you would prefer young boys and young girls to get vaccinated in order to prevent that?
No, absolutely. I mean, the biggest strides in medicine are not all the flashing lights and bells and whistles you see today about saving things. I mean, certainly the cardiac surgeons have done a lot, and the cardiologists, heart disease is still the #1 killer. And we've done a lot in cancer, but if you talk to your grandparents, people didn't live to be 60 because of infectious disease. Now, we don't have a tuberculosis vaccine. We conquered that in another way, but polio, tetanus, smallpox, those are things you don't even know anybody probably who had those diseases, and that's because of vaccines. So the biggest, the public health aspect of medicine is where the greatest strides have been made in this country.
All right, so parents, that is a good bit of information for you right there, but you can also probably, what is a good internet site to go to learn more about the HPV vaccine?
I think that you can go to the American Academy of Pediatrics. I think that's a good
great site. Okay.
You can go to the National Institutes of Health. There are a lot of sites
Reputable
out there.
sites.
Reputable sites. There are a lot of sites out there, and there is a lot of misinformation out there.
Okay, so they can go and get their HPV vaccine from their pediatrician?
Right, and this is not a live vaccine. This vaccine is made from the capsule that the virus hides in to be transmitted. So there's no risk of the actual infection with this vaccine.
All right. Thank you so much, Doc. You have a great weekend.
Okay.
Not weekend, a great week.
Yeah,
I'm ready for the weekend.
I'm
exactly.
ready to.
We'll be right back with much more Local 33 News.